Hello, I'm Muna Al Harbi, and this is episode 3 of MS Talks Keep Moving Forward. Today, we're going to explore the importance of having an open communication with your healthcare professional and what to expect when visiting a neurologist. It can be an anxious time, especially for people who were recently diagnosed with MS. Today, we'll speak about the importance of the relationship between the patient and the doctor and some tips on how to manage this relationship. There is no need to suffer alone in silence. Joining me today is Dr. Ahmed Shatila. Dr. Shatila is a consultant neurologist in Sheikh Shakhbut Medical City, Abu Dhabi. He cares for 300 patients, where most of them are MS patients. Welcome, Dr. Shatila.
Thank you, Mona, for having me today. It's my pleasure being here.
So, Dr. Shatila, how should someone with MS prepare for a meeting with a neurologist?
That's an excellent question. First of all, what I would tell a patient or a person if they were going to see a neurologist, first of all, don't be afraid. Coming to see a neurologist can be a very scary experience. Read a little bit about who neurologists are, what we do for a living, how we exactly see patients, because commonly a lot of people think that, neurology and neurosurgery are related, but we don't do surgery. So read about what neurologists are, realize that don't be afraid. There's no such thing as dumb questions. And while all the answers may not be exactly what you would like to hear, I also would like to reassure patients and people that we have many options and there are a lot of treatments available, and we'll try to find what's best for that person.
So, what is involved initially in these kind of meetings?
What's involved initially, usually when someone comes to see me for the first time and they're suspecting that they may have MS, I usually like to tell them that the first interview or the first meeting is really more of a data gathering session. We're just trying to get the information. When did things start? How did they progress? Did they get better? Did they get worse? Who did they see? Because with multiple sclerosis, there is no one test to diagnose it. So you can't really depend on one specific test. You have to get data from multiple sources and put it all together. So I tell the patient that what we're going to do today is we're going to get the history, try to figure out timeline of when your symptoms started. I'm going to look at your images, look at your blood work, and then we'll proceed from there.
Do you think that MS patients should be prepared somehow, like preparing questions, or they should prepare a certain question or certain answer?
Definitely. I actually encourage people sometimes, when you're hearing about MS for the first time, you don't know what to expect. You don't know what to ask. So I tell my patients, write them down on a piece of paper, because a lot of times when you're in the clinic, you may forget, you may get overwhelmed with the flood of information. So you may forget, I wanted to ask this, but then you forget. So I always tell them, jot them down on a piece of paper. Let your family member remind you. So yes, it is very important to have that available.
So I understand that initially the patient should prepare his question. He should have his support system with him. But in between these appointments and the initial diagnosis, should they do anything between these appointments?
That is a very important topic, because a lot of times our patients, they look to the physicians as, I have MS, fix me. This is my problem. But usually it's a two-way street. I'll help you, but you also got to help yourself. You have to, I will give you advice. I will tell the person what are some things that they need to do. You need to take your medication. You need to jot your symptoms down if things change. You need to eat healthy, exercise, avoid bad habits. So yes, that's what I will talk to my patients in between, appointments. I'll be like, so what have you been doing for the past 2 months? Have you been trying to implement the advice that I gave you? Are you eating healthier? Are you exercising? Have you stopped smoking, for example? As well, also, any symptoms, any side effect from your medications. Those are very important as well. Most importantly, did your disease progress in the past 2 to 3 months in between appointments?
So it's very important for the patient to communicate with his doctor, even in his lifestyle and another, like his lifestyle and his habits. But what do you think is the best practice to keep track if, like, in between appointments? What is the best practice?
We have so many ways to get a hold of your doctor as well as your healthcare facilities, and different people like different ways. Some people like emails, some people like using social media, WhatsApp. Other people like just calling the nurse directly and saying, I'm experiencing these new symptoms. So what I would ask, or what I would tell my patients, is ask your doctor, ask the facility, if I have questions, how do I reach you? Most healthcare facilities now have multiple ways to reach your doctor or the nurse taking care of you, either email, calling a hotline, or social media like through WhatsApp, unofficial ways. So I would ask to tell them, what is the best practice that you have available, and how can I reach you? Because there are more than one way to reach your doctor as well as your nurse.
So every healthcare provider is different. And from your MS experience or point of view, how do you find who respect and feel comfortable with as an MS patient? How can they find a healthcare provider that they can be comfortable and they can feel them and there is a respectful relationship between?
That's a very important question, actually. Having a physician or someone you trust is extremely important, because you are opening up to a stranger you may have just met last month. And it's very important to have that trust, because the physician cannot take care of you if you don't trust that person to tell them all the issues that relate to you. There are multiple ways that you can reach out and find a physician. You can ask friends and families, social media, MS societies, see who are caring for people in your area. But, finally, last but not least, sometimes you just have to go see for yourself, talk to that physician, and usually you'll just know. It's one of those feelings that when you start talking to that person, you'll get a feeling. Am I comfortable? Do I feel like I can tell this person? Is he judgmental? Does he listen to me? Or am I just another diagnosis? So these are things I would tell as a patient. These are things that you want to look for in your physician.
So you mentioned family and friends. How much is it important for family and friends to be in these meetings or appointments?
Family and friends and your support group are extremely important. They're like the hidden warriors. We think about MS and we always talk about the patient. But MS isn't just the disease of one person. It affects not just the family, but society in general, So having that support group with you is extremely important for a couple of things. If we go with just the diagnosis stage, once you get diagnosed with MS, there's so much information that may be coming towards you that people tend to block out after a certain amount of time when they hear news they don't like to hear. So family is important, or friends, at least to gather that information so they can also tell the person later on. But also family is extremely important, because sometimes you may have symptoms that either you're too embarrassed to tell me about, or you may have just forgotten to tell me about. And the family may notice, yes, while this person is doing well, I've been noticing that their memory is progressing a little bit. They're worsening. They're having trouble planning out their day, even though the person himself may say, I'm great, life is good. So I think they're a source of information for the doctors, but also they are your support group.
Well, many people can be anxious when they see their doctors, but why is it important to have this open communication relationship between the healthcare provider and the MS patient?
That goes back down to the main issue, or being a physician. It's about trust. You have to trust the person that you're talking to. If you don't trust that person, how can that physician help you? If you're wary or you're somehow nervous, is he doing or is she doing what is best in my interest? You have to have that trust. But also, if you don't trust the person, how can you tell them about all your problems? There's MS, but multiple sclerosis affects a lot of aspects of everyday life, ranging from physical to cognitive to sexual to urinary. And if this person is embarrassed or too afraid to talk to the doctor in front of them, I won't be able to help them. While sometimes you may think the problems are enormous, and they are. Every person's problems are huge to that person, but the solutions may be very simple. But if you don't share it with your physician, you may needlessly suffer from something that was so easy or not as bad as you once thought it was.
Well, that takes me to my next question. If people aren't open and honest with their doctor or healthcare provider, how can that impact managing MS?
It could impact in a lot of negative ways. First of all, as I was saying just with the previous answers, that if you're not open up to your physician or your doctor about what you're feeling, you may not get the best treatment, or you may not get treatment for seeming seamlessly easier problems while you were thinking they're horrible or bad, and you're too afraid to talk about it, but the solution may be simple. But also, if you're not telling your physician about your new symptoms, your side effects, are you progressing? This may, if when you see your physician and I ask you, how are you doing? And you're like, everything is great, and you don't want to tell me that you may have had a new relapse, you may stay on the medication while you're still progressing, or which may not be the best option for you. Or if you're too afraid to tell me that you are now having a change, you're now thinking about having children, this medicine may not be the best medication for you. So you have to trust. It always goes down, if you do not trust the person in front of you, who you're going to be telling, basically, you are pouring your heart out and with all your troubles, you need to find someone that you trust, because that physician cannot help you, unfortunately. And trust is the most important thing.
Yeah, that's true. Well, my final question is, from your experience with MS patients, do you have a challenge in breaking the news to a new MS patient or one that has been diagnosed for a while?
Yes. So sometimes, I get people or patients who come to my office. They're coming for the first time. They may know something's not right, but no one's ever mentioned MS. So I usually don't give the diagnosis that you have MS on the first visit. Usually I tell them this is a fact-finding mission. We're here to gather all the evidence, all the data, and we'll put it all together, and then I'll have a better idea of what you may or may not have. So that's the first thing. Second, so at that point in time, I may tell the person that, there's some talk that you may suffer from MS, and I'll kind of forward them or show them some websites or information where they can get some trusted information. But I usually don't give everything all at once, because once people get news that they don't like to hear, a mental block develops, and everything you say after that just it doesn't register. So that's why it's important to give it, I tend to give it piece by piece. I do a lot of repetition. I may say the same thing over and over in different ways, just because people may not always hear you the first time. I also will give them information. There are either flyers or certain websites or societies that they can look into. Another thing I'll sometimes do is I'll ask them if they're comfortable, they like to speak to somebody who has MS, who's around the same age, same culture, same gender, so that they can also share their concerns, and maybe that person can help them as well. So everyone has a different style, but usually I tend to not give all the information all at once, because it's just so much, and I tend to break it down.
So communication, trusting your health provider, and being honest with your health provider is very important, as Dr. Shatila mentioned. And many thanks to Dr. Shatila for being my guest in this episode. He is certainly an unusual doctor who really gets us as MS patients. I can say that for myself, that he really gets us and understand what we go through. Thank you so much.
Thank you, Muna. It was a pleasure being here today. And as you had emphasized, trust is the most important thing. You have to trust the person you're talking to. But also you need to know that someone with MS, you're not alone. Is while you may feel that you're alone, you are not alone, and there's nothing to be ashamed of. Everything that you felt or you are experiencing, I'm pretty sure your physician has heard of these complaints from other people. So never be afraid to ask, never be afraid to ask why, and always know that there's always help available.
So reaching out with your concerns is very important. Thank you so much, Dr. Shatila.
Thank you, Muna.
On the next episode, we are joined by two nurses, Nurse Esma and Nurse Joelle, to discuss how MS doesn't just affect the patient, but it can impact the family as well.